Good afternoon, everyone. This is Vikrant from Physiorevive, and as you know, today we're gonna share a little bit about the evolution of physiotherapy, the history. As today is a very special day, all across the world, 8th September is being celebrated as a World Physiotherapy Day. So this is the day across the world we celebrate physiotherapy profession, which has contributed a lot to the healthcare in the modern sciences of health or medicine. As we all are aware, it is a day-to-day part of everybody's life nowadays because has become so much advanced nowadays, and we all, some way or the other, we require some sort of a movement or physiotherapy we are associated with as a normal population. So today's talk will be more to put some light, especially about the history of physiotherapy. Before I start, I just want to start with the definition. As physiotherapy is a part of modern medicine science, but it is young as well as old also. So if we go to the definition, it is the part of the modern medicine comes under allied health profession, and it is a science of movement which helps to restore the human body function, well-being, and day-to-day activities of daily living through physical means, not through medicine. So that's the beauty of this profession, that without medicine, without surgery, we are treating the patient's symptom and conditions, and we improve their quality of life, which includes different aspects of physiotherapy. So if we go into the history, it was basically started in ancient times by the Hippocrates in Greece and other parts of the European countries. But it has been noted that history of this profession lies with many countries, including China, even some part of India in the ancient times, and all across the Europe. So if we talk about Hippocrates in 460 BC, they started practicing hydrotherapy, which is a form of a physiotherapy, and manual therapy techniques, and some sort of massages, which actually contributed to the evolution and betterment of the human and mankind. The person who's called the father of physiotherapy was a Swedish person named Per Henrik Ling, who started in a gymnastic club sort of a center where he used to treat people with the movements, with exercises, and it was also called Swedish movement treatment. Later on, the main evolution happened somewhere around 100 years back. In 1890s, there were 4 female nurses from UK who established the Chartered Society related with physiotherapy. And then in 1916, the first school of physiotherapy was established in US also, and in Otago University in New Zealand. Then comes a very major milestone, that was in 1921. Somewhere around the World War, people were getting aware about a treatment which is non-medicine based, through exercises, through movement therapy, and through other different techniques. People were treated, especially during the First World War. The injured soldiers and all other people were treated through this. So one of the major milestones happened in 1921 in America, when the Association of Physiotherapy was established, which was later renamed into American Physical Therapy Association, called APTA, which you now know is one of the leading association across the world. During that period, it really evolved from just a part of one profession, medicine science, to an established profession. As far as India is concerned, during early 50s, it was a need of an hour. There was a polio outbreak across India, especially on Mumbai side, which at that time was called Bombay. So Government of India and the state governments established some centers related with physiotherapy. there was a hell lot of changes happened across Second World War, and it came into a limelight that there is a profession where patients are treated without medicines, through movement therapy, through different manual techniques. And now, if we look back, the journey of last 100 years, it has really evolved. And if you're not aware, then just for your knowledge, our association in India, the Indian Association of Physiotherapy, was established in early 50s, and the World Confederation of Physiotherapy, called WCPT, was also established in 1951. And at that point of time, the profession was usually dominated by the females who moved from the nursing profession to this profession. But then this changes started happening, and the road to go for a full-fledged profession was started. So at that point of time, electrotherapy was evolving. Electrotherapy is called treatment through machines. So at that point of time, the basic modalities started in India and across the world. And later on, in early 80s, there were changes started coming and happening as far as electrotherapy and other techniques are concerned. If we go back to the research part, it was the first scientific paper somewhere in early 1850s where, actually it was established that, physiotherapy or the movement therapy has given the treatment to the patient, and that has really helped the patient to come out from the problems and conditions which are related to movement. And then in early 90s, there was lot of changes. There were many changes which were happening all across the world, whether it is Australia, New Zealand, Europe, or America, or UK, or even in India, in our country. Many schools of physiotherapy, they started giving post-graduation courses also. So the profession started getting specialized into different forms, like at that time, orthopedics physiotherapy, musculoskeletal physiotherapy, chest physiotherapy, and cardiac physiotherapy, gynae and obs. All these professions started coming, and especially the sports physiotherapy, which is playing a very crucial role nowadays all across different part of the globe in different sports. It enhances the performance of the patient or the person or the sports person, and it basically acts as a preventive measure also. It works on that principle also, how to prevent injuries. So it's not only the treatment part, it is now more emphasized direction towards avoiding the injuries, correcting the physiological functions of the person. So that is a little bit about history. Now, if we come to different specialities, there are now new arenas which are opening up in this profession. So everybody has realized in recent times, especially the COVID times, the importance of chest and cardiac physiotherapy, where in COVID-19 the functions of the lung got deteriorated, and physiotherapy, chest physiotherapy especially, played very important role to recoup from the condition. So this is just one part. The most commonly seen specialty all across in our daily life is musculoskeletal physiotherapy specialty, which is related with bones, joints, pains and all that, where patient usually have neck issues, shoulder issues, back issues, knee issues, and they are being treated and they are getting benefited through the advanced techniques which are happening since last many years, and it is contributing towards improving the quality of life of the mankind. It has really improved the longevity of the human being, and as far as the quality of life is concerned, that has also markedly improved. So one can say that movement is the new medicine for the health. So that's the new tagline which has come up in last couple of years, that if you're moving well, if your movements are better, obviously with physiotherapy and all specialities of physiotherapy, That's the new medicine to achieve good health or to have a healthy lifestyle and to have a very good quality of life. Now, beside that, I just want to share here a little bit about my personal experience, why I came into this profession. It's almost, I'm talking about 28 years back when I was in school. I was in 10th, 11th standard, and I met an injury in my knee and I got a meniscal tear. Then I was being treated by a physiotherapist, where I came to know that there were two options for me: either to go for an arthroscopic surgery to get the meniscus removed, or to go under physiotherapy at one of the hospital in Delhi. So that really mesmerized my imagination, and my interest and curiosity got generated more towards this profession, and I really wanted to be a physiotherapist at that time, which I realized when my dream came true, when I got an admission in my physiotherapy course. And then the journey is long, of last almost 25 years. I've done my specialization in musculoskeletal, or the orthopedic we call it, and then in sports physiotherapy, and now going to finish my doctorate with the same profession. So this is about a little bit about my history of how I came into this profession. As far as number of patients I have treated in my clinical career, it's almost more than 75,000 patients which I have treated. And in last couple of years, we've started documenting cases also, especially with a new technique called dry needling, where we have a documented cases which we've treated successfully. It's more than 10,000. So that's a good number, and we are trying our level best to contribute towards the improvement and quality of life of the patient or the clients which comes to our clinic. A little bit about my clinics. There are two clinics we are having in Delhi. One is in central Delhi in Karol Bagh. The second one is in Vasant Kunj in south of Delhi. And we can say proudly that we have a center of excellence related with ortho sports injuries right at the heart of South Delhi in Vasant Kunj at Physiorevive, where we deal all sort of cases related with orthopedic issues, sports injuries, related post-surgical care, and related to chronic conditions of pain of musculoskeletal origin. This is a little bit about what we do in our clinic. So for somebody, I'm sure there is no one nowadays, or there are hardly people who have never come across with any physiotherapist till now, because everybody suffers from something or the other, some condition, whether it is a neck issue or a shoulder issue because of our lifestyle. Lifestyle has become too fast. We are more sedentary sort of, and that has really given a big change in the society. And everybody faces these issues of pain, strain, back pain, knee pain, and all that stuff. As the modern medicine science has evolved, so the longevity has improved, the quality of life has started improving, then these problems started cropping up more. And physiotherapy plays a very crucial role all across the world to minimize the discomfort, to improve the function, to improve the quality of life. So this is a little bit about the physiotherapy part. Now, as far as somebody who's thinking that when one should contact to a physiotherapist, which may come into your mind like, do I really need a physiotherapy or a physiotherapist? So I'll give you a brief idea. If anybody has any kind of a problem, any kind of a pain, discomfort, lack of movement, difficulty in doing activities of daily living, for example, if you have a trouble, you have a sitting job, if you feel that some discomfort after sitting for long hours, or doing your household work, like for a female who's working in a kitchen and doing routine household chores, at that point of time, if you feel that something which is not getting better, any sort of a pain or a discomfort, and it stays more than 72 hours and it's not getting relieved, then this is the time when one should definitely look for a good quality of physiotherapy by reaching to a good professional physiotherapist. And then the most important part will be, the first part will be, in your first visit will be that a therapist or the physio will do a diagnosis through clinical tests, through some radiological examination, through assessment and the physical examination. So first thing which is important is your diagnosis. What exactly are you suffering from? Once you know your diagnosis, then comes the second part, how to treat it, how to do the treatment, how to execute the treatment plan. So here in Physiorevive, what we do is, after doing an assessment, we come to the conclusion of a diagnosis, and then we execute or we make a treatment plan for the patient, which may involve electrotherapy, which is basically usage of advanced machines, which includes laser, high-end laser, which includes interferential therapy, which includes shockwave therapy. Nothing to worry about the name. It's not a shock kind of a thing. It's an advanced treatment plan where we treat conditions. Then comes ultrasound, which was there since very long time, and then comes the manual therapy techniques, where the hands of a physio plays very important role to correct the condition, which involves some sort of adjustment of or the alignment of the spine or the joints to improve mobility and the functions of the body. And the same, one more part of manual therapy is dry needling, where we use small needles like hair thin needles, single use needles, filiform needles, to deactivate the trigger points or the root cause of the pain. So it's very important to have a diagnosis. To get a diagnosis, the professional to whom you are going to consult should be qualified, should be experienced enough, who can deal with your condition, to understand that condition better. And then comes the treatment plan. In that treatment plan, what we do at Physiorevive, that we explain thoroughly to the patient about the condition. So that is the counseling part. It's very important to make the patient aware why they have suffered and what exactly they are suffering from. Once they come to know about that, we can make them a part of the treatment, because nowadays the most scientific approach is biopsychosocial model, where the therapist and patient-centric approach is the one which we accept and we apply, and patient's treatment revolves around the patient, and patient is a part of the treatment. So it's very important that those days have gone where a doctor or a therapist used to be treated like a god, and whatever he or she has said is something everybody is going to accept. Things have changed now. It is the era of information, where maximum number of things or the info about the condition which a patient is suffering from to be shared with the patient, so that patient can participate well in the treatment plan, and he or she can able to avoid those things in future to get a quick recovery and to get a long-term recovery. So patient awareness is very important part of that. Then comes exercise plan, preventive care, which is again a part of the treatment. So the treatment can be divided into short-term plan and long-term plan. Short-term will be to relieve the person from the present symptoms and the condition. If somebody has neck issues, it has to be relieved. The neck pain, the mobility or the movement of the cervical spine or the movement of the shoulder joint should be improved. Then comes the second part, which is the long-term treatment plan, which comprises basically of two things. One is the preventive care, how to educate a person or a patient what he or she is not supposed to do. For example, if nowadays everybody has a sitting job, they have to sit, there is a work from home culture nowadays, and people used to sit a lot in front of a screen. Their screen time have gone up, everything is in the phone usage have gone up. So that causes a lot of stress all across the neck, upper back and the shoulder, even the lower back. And the other aspect is the weight gain, which is very common. Everybody faces these issues nowadays. They are putting up weight because there is less mobility. Everything is available on the phone. Everything can be delivered at your home. So it has made us a little more lethargic. We are doing less movement. The researchers have shown the average movement of the human being have really gone down as compared to a couple of years back. So this is something which has to be emphasized. And preventive care plays very important role. And in preventive care, lot of counseling part is involved, where patient has to be told what what he or she is supposed to do and what they should avoid. And then we have to inculcate a habit of doing good movements or good quality of exercises, good quality of movement or motion in the body, so that in the future the similar problem can be avoided. That's the one of the key factor of any treatment plan. So if you're going to a physio, this is very important to ask about your condition. It is the duty of the therapist or the physio to explain you in detail what you're suffering from, what is your diagnosis, and how you can avoid by following do's and don'ts. And as at Physiorevive, we give this analogy to our patients, whoever come to us. It is like going to a school. If you send a baby to a school, the baby has to study in the school also, and once that baby is at home, they have to do homework. So same way we explain our patients that whatever exercises we are explaining to them, which they are doing it in front of us at the clinic, at our centers, they have to replicate similar way by doing exercises at home, so that they can get into a habit to do these things on their own. And the main aim of any rehab or any kind of a treatment will be to make the patient independent. We do not want the patient should be dependent on us. So in every 3, 4, 6 months, this is a very routinely seen scenario where a patient has some issues, he or she will go to a physio, get some treatment done, and then again after 3 months, 6 months or a year, they'll be back to square one with the similar issues. They visit again the clinics. We at Physiorevive do not follow this kind of a practice. We tend to make people aware, our patients aware about the condition, and we really want a long-term solution of the problem. So we always give this analogy that it's a 50-50 role of both the parties. That means 50% role in your problem will be yours, and 50% will be the role of a physiotherapist, that is us. So when we both play our roles, we'll get 100% recovery. So it's very, very important to have a scenario, kind of a clarity what you're supposed to do and what you're supposed to avoid. Same ways, one more thing I want to share here, like the kind of population I've treated in last couple of years, as far as the age is concerned, from minor 1-day-old baby in the neonatal intensive care unit, NICU we call it, in our hospital centers, to 97-year-old lady who was suffering from knee osteoarthritis. So we are very fortunate enough that we cater to all different part of the society, whether it's a young newborn baby to somebody who is so old, 90 plus or in their 80s. This is the most fortunate part, that we feel privileged to cater to the society in this way. So this is one of the aspects, because usually people in medicine, there are some specific specialty, like a pediatrician will see a pediatric cases only, a geriatric a doctor will see a geriatric cases only, but we are very fortunate that we have a different spectrum of all across the life, and we treat them. So this is a little bit about our profession and a little bit about our Physiorevive. As far as duration of the treatment is concerned, many a times people think that treatment should be given for this and that time. So let me tell you one simple thing: no two people are same, no two conditions are same. So we can't treat a patient with a watch kind of a thing, like you will be treated in half an hour or 45 minutes. Usual session time on the very first day is almost 1.5 hours in our center. So if you come, just be mentally prepared for that. And then the follow-up are depending upon your condition, how you are recovering, whether you are in an acute phase or in your moderation or in your advanced phases. So this is how we treat patients all across in our centers. So with that, my take-home message to you all should be that try to maintain your quality of life by following certain do's and don'ts. Keep yourself moving. Don't be stationary. If you really want to avoid lifestyle disorders, or if you really want to avoid the conditions like diabetes, hypertension, and try to have a healthy lifestyle, which includes avoiding those psychotropic substances, alcohol, smoking, and to maintain a good quality of life. And it is very important to have a physical activity. As per the WHO norms, every person in this world, at least 30 minutes, 6 days to 7 days a week, they have to work out. That can be as simple as going for a walk or pursuing one specific sport. So that you should be keeping yourself motivated, you should be keeping yourself mobilized, and by following such a simple thing, you can avoid the conditions for which you might have required to go for treatment. So better is prevention instead of a cure, but if you are suffering, there is always a cure. With that, I really want to conclude, and if anybody has any question in mind, I'll be happy to take that. Anyone has any question? So let's do one thing. Let's take a pledge today that we will not sit idle, and will at least 5 to 6 days a week, we should start doing some sort of a physical activity, whether it is a small walk. You can always start with 10 to 15 minutes of walk, which you can gradually move up. One thing you should note down is, if you have pain, you should definitely contact somebody who's a professional enough in our profession, a specialized, experienced physiotherapist who can understand your situation, and do not do a self-medicate kind of a thing. For example, if somebody has some issues, they're trying to follow nowadays a lot of social media or a Google or a internet, my suggestion would be, it would be better if you consult somebody who's professional enough, instead of just following somebody else treatment plan or kind of exercise or a movement. Never ignore your problems, never ignore your pain, never ignore your discomfort. Try to have a good quality of life, because that is what all matters. So maintaining good physical activity will keep you mentally fit also. It's not only the body. If the body is fine, then comes the mind, better mind. So both are interrelated. If you are physically better, it will definitely help you to have a good mental health also. So with that, I would conclude. If anybody has any question, then definitely I'll like to take it. Anyone? Right. Okay, with that, I'll like to conclude, and I wish everyone a very good health, and keep my words in mind. Movement is life. So don't stop your movements. If you have any issues related with any of the movement, whether it is any joint, your neck, shoulder, knee, back, anything, do consult somebody who's professionally equipped enough and who's experienced enough to understand your situation. With that, I would like to thank everyone who has participated today. Thanks a lot. Take care. All the best.